Public health officials here in New York City have said that now they will be focusing on getting the monkeypox vaccine to those people who have not received the first dose. And of course, this puts into question if this is going to put at risk those who haven't already received the first dose. Complete chaos. That's what New Yorkers are calling the process to get monkeypox vaccines in the city.
When I went to go get the shot, they said to me, well, we're not scheduling shots for the second dose because we don't know if we're going to get them.
Albert Lewitton, a New York media executive, is one of a handful to get the first shot, and like others, is uncertain he will get the second one.
That doesn't mean we don't agree that a two-shot dose is ideal, but we are in an environment of increasing cases, extreme demand, and extremely constrained supply. We do believe one shot does confer significant protection, if not as much as two shots.
New York's health commissioner working quickly, contradicting advice from the FDA and CDC, where the vaccine is meant to be given in 2 doses, with the second jab administered 28 days after the first to be fully effective.
The process was a nightmare.
All appointments gone within 7 minutes.
There were constant glitches. And then when the vaccines became available, you had to go on as if you were looking for concert tickets.
Community-based organizations are extremely concerned, calling the vaccine distribution inequitable.
It's a very small amount of vaccines, hardly enough to ensure immunity, even for the LGBTQ community alone.
Anthony Fortenberry, Chief Nursing Officer at Callen Lord, an organization focused on LGBTQ plus healthcare, says health officials should immediately create a stronger plan. The majority of cases are among men who identified as gay, bisexual, or men who have sex with other men.
As it's been said many times, monkeypox, we call MPV, does not discriminate against anyone.
What do you think it will happen if public health officials do not stop this outbreak quickly and effective?
We are seeing significant scarring from these lesions. We are seeing income and housing risk for people that are unable to work during these 2 to 4 weeks of isolation.
Fortenberry says communities of color and minorities face the highest risk.
Sadly, I don't think that our public health infrastructure has prepared us for this next outbreak, despite having been aware of those disparities.
I think the biggest thing that we're probably missing is an underreporting within other communities.
Tayshawn Osher, Director of Communities of Color and Media at GLAAD, the world's largest LGBTQ plus media advocacy organization, agrees. He says education should be part of the national community outreach.
But it is also thinking about, we know that there are confirmed cases of people who have monkeypox that are not within, the LGBTQ community. And so I think it's important to just understand that, yes, the highest rates are happening over here in this particular community, but it also can happen in any community.
New York Governor Kathy Hochul says she expects the state will get a major increase in monkeypox vaccines later this week. New York Governor Kathy Hochul says that the state will receive at least 33,000 new doses of the vaccine later this week. As of right now, the state of New York leads the nation with the most cases, the majority here in New York City.